So Adam, making the decision to start weight loss injections can seem really confusing because there seems to be lots of different alternatives. So can you explain a little bit about the type of injections that are available?
Yeah, I think the sort of landscape of weight loss treatments have changed massively in the last few years, which obviously I think a lot of people are aware of. There are still oral medications you can use. The common one that's used is a tablet called Orlistat, which you take 3 times a day with meals, and it actually works by stopping you absorb fat. The thing that stops people using that generally is the side effects it can cause, sometimes some gastrointestinal side effects. Which
can be pretty unpleasant, can't
it tends to put people off. Then in recent years, we've had these injections come onto the market. Now, some of these injections have been around for quite a long time, actually as diabetes treatments. And we've known for a long time that they do help with weight loss, but the newer ones seem much more effective and are now licensed for treatment as weight loss medications. We have injections like Ozempic and Wegovy. They are what's called GLP mimics. And they essentially mimic a hormone in the body. It helps control people's appetite, helps them lose weight, and brings with a sort of range of other benefits, like cardiovascular benefits and reductions in cholesterol.
So when you're taking them, you don't feel hungry then?
They tend to reduce your appetite, which obviously stops you eating so much, and that's how you get the weight loss benefit. More recently, there's Mounjaro on the market, which has got two actions. It mimics 2 different hormones, GLP and GIP. And actually recent studies show that Mounjaro seems to be most effective in terms of weight loss, and some evidence that it's got less side effects or side effects are better tolerated than the other medications.
Okay, so what generally are the side effects that somebody might experience on the injections?
Most people get on very well with them, but there are obviously, like any medication, a wide range of side effects. Common things are a bit like Orlistat, in fact, some gastrointestinal side effects, things like constipation or diarrhea or abdominal pain. There are a few more severe ones, which are quite rare. So there is a condition called pancreatitis, where you get inflammation of the pancreas, which is causes a lot of abdominal pain and can make people very unwell. And there has been concern historically, or there is concern that there is an increased risk of some kinds of thyroid cancer, particularly in people who are already predisposed to that with various inherited conditions. But as I say, most people get on pretty well with them.
Okay, that's good to know. And I'm sure this is the $1 million question, but how much weight can somebody expect to lose on an injection?
Yeah, well, I mean, the evidence is pretty good. Some of the studies show even as much as 22, even 25% of body weight.
That's a lot.
It is a lot, yeah. It takes time. Those studies are done over a period of pretty much 2 years, really. So it's not a sort of magic bullet. The weight doesn't just fall off. But if you stay with it, particularly if you combine it with proper lifestyle changes like diet and exercise, then the weight loss you can achieve is pretty remarkable, really.
And how long would somebody need to stay on an injection to achieve the weight loss that they want to? Or is that a bit of a how long is a piece of string kind of question?
No, not really. I mean, so basically the studies I've just mentioned, they talked about staying on the injection for 72 weeks at the maximum dose. So you use a period of build up to the maximum dose. So overall, those kind of weight loss gains are about 2 years. You will probably notice benefits within the first month or 2 of using it, and then it's a sort of steady progression from there.
Okay, yeah, that's kind of what I hear, is that the weight loss can be, you can see it quite soon, which I suppose is quite motivating for somebody to stay on it, I'm assuming.
Yes, and I think for a lot of people, they've come to weight loss medication as as an option, having tried lots of other things, dietary options and things in the past, and the weight loss that they can see tends to keep the motivation going, tends to keep the drive to keep going with it.
And what are the factors that make somebody consider using weight loss injections?
I think it's very individual for different people. But generally it's for people who have struggled to lose weight doing other sort of traditional methods. They've usually tried lots of exercise, they've tried different kinds of diets, and haven't seen the benefits that they wanted. For other people, the weight loss perhaps is more pressing because they've got other medical conditions related to their weight. So raised cholesterol, high blood pressure, polycystic ovarian syndrome, and a range of other things like sleep apnea, which all of which impact on the quality of life and will be benefited by losing weight.
Yeah, absolutely. And I know that when someone is considering starting injections, it's really important that we have an up-to-date BMI. Can you explain a little bit about why that is so important?
Well, so the medications are licensed for treatments of people with elevated BMI. So if your BMI is above 30, then they're licensed to treat that. Or if your BMI is between 27 and 30 with one of these weight-related conditions. I think the main thing is these are the people that are going to benefit most from weight loss. And in people with a normal BMI, if you were to take these medications, it can cause, unwanted weight loss for one thing, but also loss of things like bone mineral density and muscle mass, which obviously are things you don't want to happen.
Yeah.
So really, they shouldn't be used by people with a normal BMI.
No, although we certainly hear of times that they are used when they shouldn't be, don't we?
Yeah, and that's been one of the concerns, is actually people accessing them inappropriately and using them inappropriately.
Yeah, so it's important to have a strict regulations, isn't it, really, with regards to who we're giving injections to? Exactly,
and that's one of the reasons we've set up our service, so that actually there are doctors involved all the way through. We run blood tests and we do proper BMI verification in our clinics to make sure we're doing it safely.
Yeah, totally, really important. So tell me about the blood testing then, and how that can enhance the service that we're providing with regards to weight loss management.
So I think there's sort of two functions of blood testing when we're talking about weight management. There is a safety function, which is to make sure that people's liver function is okay, their kidney function is okay, and that they're safe to have the medication. And then there's also a sort of motivation factor in seeing benefit. So what we will expect to see with people using the medication is things like improvement in cholesterol levels, improvement in blood sugar levels, and for people with things like fatty liver disease, hopefully improvement in things like liver function. So, and seeing those sort of biochemical improvements in your blood tests is also another big motivator.
Absolutely, yeah. And it's really reassuring then for the patient that it's all going in the right direction.
Exactly, yeah. So you can see the benefit both sort of externally and actually the benefit to your overall health.
Yeah, fantastic. So obviously, as well as taking the injection, lifestyle is crucially important. Yeah. How do you advise a patient? What do you suggest that they do to make sure they've got a really good, healthy lifestyle as well as taking injections?
Yeah, and I think you're right to emphasize the importance of the changes you need to make, because the injections are really just a tool to aid weight loss. If you don't take advantage of the weight loss you're achieving with the injections to put good lifestyle changes in place, then what tends to happen is you stop taking the injections at some point and all the weight will come back on and you won't have made those really important changes that will keep you healthy for the future. I mean, the lifestyle advice that we'd give is I suppose it's the same sort of boring stuff we always say, which is exercise more, be active, and eat a healthy, balanced diet, which is low in processed foods, low in sugar, and full of, the right vitamins, nutrients, minerals, the balanced diet we always recommend. So it's from that point of view, being on the injections to lose weight isn't as revolutionary as it seems. It's just an extra add-on to all the other advice we've always given in the past.
Yeah, absolutely.